moving on next, I'm going to go ahead and introduce Kristal Reyes. And Kristal is going to walk us through the Staywell project, which is a partnership with the Neighborhood Service Organization and MDHH, correct?
Yes.
Awesome.
Give me just 1 second to get all set up. You think that by now, right, that I'd have it all together as far as sharing in groups, but that is not always the case here. So let me, there we go. And let's see, there we go. So let me get this up for you all.
For some reason, it's really, oh, there we go.
Uh-oh. Let me give you the whole screen, right? How's that?
There we go.
Okay, perfect. So let me start with saying my name is Kristal Reyes. I am the director of First Step Referral Services. I'm actually the owner of First Step Referral Services in Washington County. We are a substance use treatment facility based in downtown Ypsilanti. I also work where this project comes from. I also work hand in hand with FEMA, MDHHS, and as the director of crisis services for NSO, part of my responsibility is to get this information out to as many Michiganders as possible. Let me start by saying a lot of this information, at least in the beginning, is going to be some information that we've probably already heard, tidbits from different places, in different spaces during this pandemic, but I'm here to bring it all together and then to offer some resources, not only for the people that we serve, but also for ourselves. So welcome to the webinar. I'm going to be engaging you in resources. Again, like we talked about before, today's webinar is presented on behalf of MDHHS and FEMA. Let's see. FEMA funds the process. So this is through like the disaster assistance program. So the same program that many areas use during hurricane or floods or anything of that nature. This is the first time in FEMA's history that has been a national pandemic, a national crisis in which they've had to service the entire, US. So today we're going to validate, normalize, and humanize the individual response to COVID. I'm going to engage you in the utilized Staywell crisis counseling line. So I'm going to offer you some resources about how to get in contact with that and how to get that into the hands of the people that we serve. I'm going to offer some population specific information, and then at the end or even during the presentation, if you have any questions, please feel free to ask. So we all know this already. How do we keep safe? We can stay at home except for work and other needs. Now, as the mandate opens up and those mandates kind of begin to shift and change, I do suggest that we do what feels right for us. So whether you're vaccinated or not, if wearing a mask feels right for you, then please continue to wear a mask. If shopping on peak, non-peak hours feels right for you and your family, then do the same. Making certain that we're practicing proper hand washing and all of those things that we've been doing, for the past year. I'm not here to tell you to get the vaccine, but just know that it is available, and it's been opened up to just about anybody now, all the way down to kids ages 12 or older. Some important facts to pull out that I'm sure this group is already aware of is that the vaccine helps you from getting COVID-19 and suffering the signs and symptoms that come along with having the illness. The vaccine is a safer way to build protection, and it can be an important tool, but not the only tool that we use in our tool belt to keep ourselves and the patients that we serve safe. So I wanted to provide you just with some quick data. This data is provided by the Michigan Department of Health and Human Services, and it shows how certain people have been affected by COVID-19. More specifically, I want you to take a look at the Black population, Indigenous, and people of color. Our reactions and feelings to sickness and death caused by COVID-19 are valid and real. When our communities are disproportionately harmed by the COVID pandemic, it's normal to feel sadness, anxiety, and anger. And so just taking a look at these numbers, what we're noticing is that there's a disappropriate amount of folks of color that are being infected with this disorder, with this disease, with COVID-19, versus the people of not color, so the white people, right? I think it's important also to think about how this oppression impacts your health. And so I'm a woman of color, right? And so I have a higher propensity to have this disorder, especially if I live in Detroit versus living in Ann Arbor. When we think about the living conditions that shape where we live, grow, and age, aspects of our social identities make us vulnerable. So these are just some areas to think of as far as people who may or may not be disappropriately affected by the pandemic, right? So we already talked about our race and our ethnicity, but we also have our class, our ableism, and our sexism. So are we able to get to the doctor? Do we have access to be tested? Do we even have access to get to the clinic that services for us to get the injection or the vaccination? So right here in Ann Arbor, right down the street from the Ipsy Transit Center, which is where my office is, there's a shuttle that carries folks to get the vaccine and brings them back, right? And the busing system in the Washtenaw County area is superb. But when I come and work with the patients or consumers that I work with in Detroit, that is not always the case. So these folks may hear that they have access to the vaccine, right? But how to get there, like how to operationalize getting there and getting that done for their families can be challenging. For those folks that work at the local grocery store or somewhere in their area that may not have higher education, taking off work to get the vaccine and then having to take a few days off if they are feeling ill or if they're having any pain or discomfort after the vaccine can also be challenging, and that can stop them from getting the vaccine just in general, just because they can't feed their families. So these are all important factors to consider when we're treating our patients. So I'm sure this team already knows, but you can get the vaccine from just about anywhere at this point. I see they're opening up at CVS and all these other locations. But for anyone who's looking to where to go, or if you get any calls from anyone that might need some additional guidance on where to go, they can certainly go to the Staywell counseling line, which is michigan.gov/staywell. That information is updated just about to the moment with the most recent and up-to-date information. So if you've got someone that's in, let's say somewhere up north that they're calling you about, you can send them to this website and they're able to go straight to this website and determine who and where and how in their area can they be vaccinated. And then the final slide about vaccines is that no steps were skipped in the development of the vaccine. Vaccines will not give you COVID. They will not cause you to test positive on a viral test. And people who have gotten sick with COVID, so therefore people who have already suffered and recovered from COVID, can still benefit from getting vaccinated. And then one last thing to make sure that we keep in mind is that the vaccine is always free. They may ask for insurance when you go to a facility to get it done, and that's just for their billing purposes, but there should never be a time when anyone is charged a copay or anything like that for the vaccine. And so I think that when we're talking to populations of folks, it's important to keep that in mind and to make sure that we push that information that the vaccine is free whenever they're ready or if they become ready. So what we know to be true is that this is an exceptional time for the world. Our downtime has been changed. Our work and home life begins to intersect. Some of us are becoming teachers and daycare facilities for our children while we work. Parents are working from home and homeschooling and trying to keep up with the day-to-day life of an adult. But we also have others that are dealing with the uncertainty of employment, reduced hours, and the struggle and fear of dealing with unemployment. And it's safe to say that for many of us, our days have turned into nights and our nights into weekends and our weekends into months. Combine all of that with feelings of anxiety, depression, uncertainty, fear, and frustration, coupled with the ability to have alcohol and marijuana delivered to your home, you have justification for substance use. A recent survey found that 55% of respondents reported an increase in past month alcohol use. About 18% reported a significant increase, and another 36% reported an increase in substance use. One of the other pieces of that particular study was that binge drinking in women also increased to 41%. And this is all since COVID. So what that tells us is that people are still using mood and mind altering substances. Even during the pandemic, they're having it delivered to home. And so, the work that we do is still very, very relevant and very important. What's also important to note is that patients that have a history of substance use diagnosis always have a higher prevalence of chronic illnesses such as asthma, COPD, diabetes, HIV, hypertension, and obesity. Those factors alone increase the risk of COVID-19, but having that and a past substance use history can also increase the prevalence of not only the prevalence of getting the COVID-19, but also it can affect and have a higher propensity of worsening outcomes. What we know to be true is that 40 states have reported an increase in opiate-related mortality, as well as ongoing concerns for those with mental illness and substance use. So from April to May, EMS services in Michigan reported an increase of 33% opiate overdoses in the area, in the Michigan area. And why this is so challenging or so important to know is that the number of runs that EMS are making during that time was down 26%. So even though they're going out less, more of those cases, there's still been an increase in those cases where we're seeking some services for opiate overdose. So what we know to be true, just like we all know, is that people are still using. They're still struggling with this disorder, and our services, the services that we all provide, are even more relevant today. There are additional residents that are out of work, without a routine, lack of social interaction. Kids are at home longer, there are less breaks, out of the home activities. What we're finding is that stressful situations caused the pandemic. More and more people are consuming alcohol, marijuana, and substances, and eating and exercising less. So what we find is that even our folks that are in recovery, or even the folks that maybe didn't have a problem or used excessively prior to the pandemic, they have found themselves being more sedentary, and maybe they're drinking a little more often, a little more frequently than others. A great example is that, those folks that came home every day after work and, had a beer after dinner, or after work at 5 o'clock, they're finding themselves drinking a little bit earlier and drinking a little bit more, because they have this time on their hands, or they don't have to be at the office at 8 o'clock to punch a time clock. So I'm gonna go through this slide, but I'm sure we all know the typical 7 questions that we would ask our consumers. I'm gonna challenge you to ask yourself, during this time, have we been feeling the desire to use regularly, daily, or several times? So I'm a person in long-term recovery, and I think it's really important that those folks who had a prior bout with active addiction, and those people who maybe don't consider themselves to be in active addiction, take a look at these questions: intense urges or cravings to use, as time progresses, that eating more of such substance to get the same effect, consuming larger amounts, spending money on substance, even though maybe your money income or your income is different than it was pre-COVID. Any lack of meeting daily obligations, or continuing to use despite any negative consequences. So if any of those questions were a yes for you, then, or any of the consumers that we service, the Staywell Counseling Service is here to help. This number at the bottom of the screen, 1-888-535-6136. If you press 8, you'll get directly to someone that can help, a counselor that can help you. They're available 24 hours a day, 7 days a week. It's free and it's confidential. And the reason I'm bringing this up, that it's free and confidential and 24 hours a day, 7 days a week, is that at the agency I work for in Detroit, NSO, what we've noticed is there has not been an increase in participation of the employee services. So we offer these services, right, for our employees to contact, as needed. And people, even during this pandemic and this increased stress and being laid off or any of this, are not using this. And so what I find is that it's really important to make sure that we have access to this as well, or that we pass this information on to our colleagues. that there is help. You know, one of the reasons that during a survey at NSO, we noticed that people weren't using the employee assistance program as often because they felt fear that somehow it wasn't confidential, or that their direct supervisor or someone within their agency or their employer would find out. And so this is a way to, and even though we know that's not true, this is a way to kind of subdue that. And so the services are free. They're 24 hours a day, 7 days a week. You don't have to offer any information to them when you call. You don't have to give them a phone number or your last name or your address or anything like that. They're simply here to help. You can call as often or as little as you want. Dr. Pino, who's the psychiatrist and the medical director for behavioral health, shares this quote: "The Stay Well Project is here to help everyone that's currently being affected. Keep in mind that this is a crisis. And what we know to be true is that following a crisis, even as we come to the end of the crisis, right, it's normal for people to have long-term and long-lasting effects and feelings and an emotional response to this. And so we've made it possible for the Stay Well Hotline to continue at least and through March of next year, and possibly longer if needed. So if those feelings are, if you're feeling some of those feelings, or someone that you know is feeling those feelings, or maybe the people that you work with are feeling those feelings, please feel free to offer this information to them. Again, it's free and it's confidential. The other piece I want to chime in about is work-related factors that can add to stress during the pandemic. So we already know up front that the work that we do can take a toll on us, right? And if you're like me, you know, I own a private practice. I work in Detroit. I'm working from home. I also have 4 children, 2 of which are under the age of 5. And so trying to balance all of these things, you know, and homeschool my 12-year-old and daycare's changing hours, it's really easy to begin to be stressful if I'm not stressed about the pandemic in general, just the things that are on my plate to do, right? And so it's important to be able to identify those things and then reach out for help as needed. So, and with that, what we call that in our neck of the woods is going to be burnout, right? If you're having any of those symptoms, again, calling the Stay Well hotline is a great way to try to get a sense of relief. I offered this information not too long ago to some folks that are working in a homeless shelter. And what we find that homeless shelters and hospitals and those type of facilities that we are, you know, come and either work in ourselves or know folks that do work in, it can be really even more stressful for them because they haven't had a break during the pandemic. You know, people are still homeless, right? Even more, and people are still going into the hospitals even more so than they were before. So just keeping an eye out and kind of knowing what burnout is, I think is super important too. And then these are just the signs and symptoms of trigger. I mean, the signs, symptoms, and triggers. So fatigue, anger, frustration, and it's not uncommon for the work that we do for us to have moments of these signs and symptoms, right? But what you're looking for is these symptoms are lasting longer than they were before, especially if they're lasting, you know, if they're overlapping from day to day, trouble sleeping, you know, bouts of tears and crying. I know in my profession, you know, the things that we do and the things that we see here can be gut wrenching. And so having some of these feelings daily on a day-to-day basis isn't necessarily a sign of burnout, but when we have these feelings consistently over a period of time, this can definitely be a sign of burnout. And maybe you don't see it within yourself, but you see it in the folks that you work with. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. I just absolutely love this quote, and I think that it's really important that we realize that even if you don't feel that sense of stress or anxiety or burnout, just keep an eye on yourself. Check in with yourself on a consistent basis, not just physically, but emotionally and mentally as well. And then I'm sure we all know about compassion fatigue. When we are kind of placed with that space of emotional erosion, as the slide says, that takes place when you're unable to refuel or regenerate. I know for our folks over at the Homeless Center at NSO, they're working overtime and undertime and in between time to make sure that they have access, that they have create access for those folks that are needing it. And with the moratorium on evictions and all of those coming to an end and changing, what they're finding is that more people are needing services. But that doesn't mean that there's any additional resources to be offered in this moment. Ways to alleviate burnout: set boundaries, acknowledge your limitations, create space for yourself. And a great example of creating space for yourself is that I have marked in my calendar for both places that I'm going to do yoga once a week and I go to the gym once a week. And so I've got those marked off in my schedule as out, right? Those are the 2 days in which I can take some time for myself. And so maybe yoga or exercising isn't for you. Maybe sitting with a friend at a coffee shop, or taking a nap, or planting flowers. I implore you to create space for yourself outside of a work environment, right? So making certain that, even if we're working from home, that our days are not running into our nights and our nights into the next day. So the final part of this presentation was going to just give you some coping skills, right? And many of you probably already know this, but I just want to reiterate the importance of it. So we all know that there's 7 key dimensions of wellness: your occupational, environmental, social, spiritual, emotional, physical, and your intellectual. If any of those dimensions and any part of those is neglected for any period of time, you can see negative effects to your overall health and wellness. So it's important, according to the CDC, to take breaks and relax and do activities you enjoy. Now, who has time for that, right? But this can be super simple. It can just be simply taking a break and turning your computer off in between a meeting. Making certain that you're staying hydrated, so if you're at home working, it's quite easy to drink a pot of coffee versus the 1 cup that you may have when you're at work or in the office. So making certain that we're increasing our water intake and just kind of checking those systems. Taking care of your body. I think it's what the CDC says, it's super important to make sure that you go to bed at similar times every day, keeping up a personal hygiene, eating healthy meals at regular times, exercising, making certain to allocate time for work and time for resting, and then try to make time for doing the things that you enjoy. So as the weather breaks, if you enjoy getting out and going to the park, or if you enjoy planting flowers, make certain that you are, even if you have to put it on your calendar, just like you do a meeting, schedule time for yourself. It's also important to know the facts, but it's also equally important to make certain that we're minimizing. I know at the beginning of this pandemic, and certainly with the political climate that we just are a little bit removed from, right? We had facts coming from us from every which way, and we wanted to stay informed and wanted to keep abreast of every single thing that was going on. I think it's important to also make sure that you're limiting the time that you spend information seeking, and make certain that the websites and channels that you are following are trusted. Stay connected. It's important to note that staying connected social isolation does not have to mean that you can't stay connected with family and friends and trust the support system. So keep in regular contact with the people close to you, phone, social media, even using Zoom and Teams to family and friends. If you feel like you're becoming overwhelmed, reach out for help, call a support, call your sponsor, call a local community mental health agency, or call the Staywell hotline. They're there to help. They're 24 hours a day, 7 days a week. Also, the Staywell hotline is not just for individual counseling. There's also an opportunity for support groups. So we have determined 10 vulnerable populations, and they offer support groups. So if you go to that website, it'll tell you when those support groups meet. So the WHO recommends at least 30 minutes a day of physical activity. So I know when I first got this slide, I was like, who has time for that, right? When? So here are some quick examples on how to stay active. Take short active breaks during the day. Play with the kids, do your daily chores. Gardening counts too. So if you have noticed that you have a 30-minute break in between your next meeting, go outside and plant a flower, or dig the hole and then come back and plant the flower later. If you are at home like me and you have kids, I used to do laundry on Saturday. Now I find myself doing a load or two every single day. It helps to keep me moving. Walk, even in small spaces. So Ann Arbor is really great for parks that we have, and so is Ipsy, right? However, you can walk on the spot, you can walk in your chair, you can walk around your apartment complex, or walk around the building that you're working from. Walking up and down the steps can keep you active. Read or work standing up. Now, this is like, what do you mean work standing up? So what they're suggesting, and I've tried this and it's super helpful, is that during meetings, especially those long ones, right? I find myself moving my computer up and moving it down so that I can stand up and work and I don't have to stay in that seated position. Stretching, even from a seated position. So stretching your ankles up and down, your arms over to the left and right, rolling your neck back and forth, stretching and arching your back to kind of get that stretch. Keeps the blood moving, keeps the blood flowing, and keeps you active. And then finally, the relaxing and meditation. If you're anything like me, my brain is always moving. I find it difficult to relax or meditate. However, I find that when I'm outside and I'm walking, I'm less likely to have my brain going a mile a minute. And eat healthy, stay hydrated. And then if you have access, there's online exercise classes if you're not really ready to go back to the gym. All of us have been and are being impacted because of COVID. The virus does not discriminate. However, there are some groups that are and will experience more hardships than others. It's imperative that we all know that we are not alone and that there are resources that help to assist in normalizing our feelings and behaviors because they're all shared. So again, this is just a promotion for us to call the Stay Well hotline, or to at least forward this information to the folks that could benefit most from it. What we know to be true is to make sure that we're passing this information along. I am a person in long-term recovery and I frequent meetings. And so when the pandemic hit and I was not able to get to meetings in the beginning, I didn't have the desire to use, but I did feel my brain going kind of crazy in the moment, right? My schedule was off. And so right now, AA and NA, along with some other online recovery programs, are offering access online. All of these platforms are free of charge. You don't have to necessarily download the app. There's some in the rooms you can get online. You also have AA, NA, and Smart Recovery. So make certain that we're passing this along or using it if we feel that we need the support. So the Stay Well counseling line is free. It is 24 hours a day, 7 days a week. If you don't want to talk to someone, you can also just go on the website here at michigan.gov/staywell, and it gives you an array of information. If you are seeing consumers or clients in your practice or in where you work, please let me know, and I can send you some simple handouts for those folks. There's also the Stay Well counseling line. There's the Michigan Pure Warm line. There's also the Michigan Crisis Text line. So there's a plethora of information on that website that we can use to, kind of offer those services to these folks that are in need. This is an unprecedented crisis and it presents unprecedented risk to the rights and safety of everyone. So please be safe and be well. Here's my contact information. So if this information is something that you think is pertinent to the persons that you service, you can reach out to me either through this email here, or Matt can share my contact information, and I'm more than happy to present this information and even tailor it to maybe the consumers or the staff that you work with. I've presented this all over the state of Michigan via Zoom to different populations. So if you find that this information is something that you think is relevant, then please reach out to me, and I'm glad to help in any way I can.
Thank you so much, Kristal.
That is all.
We can take a couple minutes here. Does anybody have any questions for Kristal? right. Well, like Kristal said, you can reach out
Sounds like they don't. So yeah, thanks for having me. If you could just, Matt, send that information out to the group. That way, if anyone comes in contact, and again, if this information isn't relevant for you, but you know someone it could be relevant for, then please feel free to forward this information out. I'm definitely here to help in any way that I can. The other thing to mention is that on the website, so I presented mostly about substance abuse because this is where obviously this particular work group. However, there are different webinars and folks that present to different populations. So the aging population, teens and families, youth. So if maybe some of this information is valid, but you say, hey, the substance abuse piece isn't for this group I'm thinking about, then please essentially reach out to me, or you can go to the website and you can connect you to the presenter or to the Staywell counselor that can help you best. So thanks for letting me share.
Thank you.